Hey all, welcome back to my channel. Today I want to discuss with you on being prepared for E-Day. You don't want to get caught off guard. I'm glad I had the support group I did, so I was well prepared and ready for just about anything that was going to be put my way. Because if something happens, you don't feel good, you don't want to leave your house. Nobody wants that. Sorry for the hot mess I got going on. I have an autoimmune disease and I haven't slept in a few days due to my joint pain. So I got my mom bun going on. But the first thing I do want to bring up is foods. Now everyone's different, but definitely the first few days to a week, you want to do like a liquidy soft diet. Some people do protein shakes like Ensure. There's even, you go to a health food section, there's a ton of things you can choose from, but they taste like crap to me, so I prefer to make my own milkshakes. You can do milkshakes, you can do fruit smoothies. Please be careful if you do not have immediate dentures. Do not use anything with seeds in it, like certain berries. If they get stuck in your socket because you can't brush your gums because the sockets are open and you could dislodge the clot, that if it gets stuck in there you can't get it out. And it can cause infections. It's just not good. You shouldn't have a seed growing in your gum. So, what I did was mashed potatoes and anything in a crock pot. You cook it there all day, anything in there will get soft and mushy and easy to eat. People have gone for tuna. People have done minced meat or deviled eggs or scrambled eggs. Anything soft really. But if you want your meats, especially after the first week, going into your second week or so, try the crock pot. I didn't do rice, only because I was afraid of the little rice grains getting stuck in my gums. So you do want to be careful. After you eat, please make sure you saltwater rinse, not vigorously. That will actually dislodge a clot, so you want to be very careful. All I did was move my head back side to side instead of actually swooshing. No straws. No straws. You got a smoothie, get a spoon, eat it like that. Do not use a straw. There is a high chance in the first, about 10 days they said, but the first week mainly, to get a blood clot dislodged, and you don't want that to happen because you want the healing process. That clot needs to stay in there. So if you see something big, dark red in there, leave it alone. That's part of the healing process. So go for the soft foods. That's main priority. You want to be able to have Benzodent. I know I tell you guys a lot, but please, you're going to regret it if you don't. Benzodent. You can get it just about anywhere. I got off mine off Amazon, so I was prepared and ready to go when it happened. I use it mainly because of my immediate denture pain. It was excruciating. Having a denture sit up here was super painful. I'm not going to lie, cried pulling it in and out. Please make sure you do not use mouthwash. You can ask your dentist or your primary doctor for a prescription of this stuff. It is actually an antiseptic that doesn't burn, no alcohol, no nothing. Use it after a week. Do not use it sooner than that because, again, you can dislodge a blood clot. Salt warm water will be your best friend. Make sure that you rinse it out. If you have immediate dentures, do not leave them out for a long period of time because once the swelling hits the max, 3 to 5 days or even sometimes 6 days, you will not get them back in. For the first 7 days, I did not take them out at any given point unless it was for a couple minutes to wash the denture, to get all the disgusting stuff you're going to have on it between the bleeding and the biofilm and, all that stuff that comes out and is part of the healing process. So don't be alarmed if you see that. Just make sure you clean your dentures with the Fresh and Bright denture paste I have shown you guys, and I will show you again once I find it. It is Fresh and Bright. It is the only denture toothpaste that is ADA approved. So it will clean, not hurt your dentures. Some people use Dawn dish soap. I've never used that before, but I know a lot of people that use it, but it is very slippery. My best advice I can tell you is they tell you to fill up your sink with water. So if you drop your denture by accident, because your dentures are slippery, that they will fall in there, but it'll be cushioned by the water and it'll float down. I don't do that. I use a washcloth. I put it on the side of my counter and I scrub right on top of there. I put the denture in my hands, but very close to the washcloth, and I scrub it that way. And I scrub all in and out. You know, it's going to sound weird, but it's actually pretty cool to take out your teeth and scrub them yourself, because you can't miss a spot when you look at them. I can't see back there with my normal teeth that I had, so I guess there's a positive in everything. But you definitely want to go for soft foods. As far as drinks goes, stay away from anything carbonated. That is not good for your healing gums. I know a lot of people pop the Monsters anyway, and sodas, but just play at your own risk, is what I'm here to tell you. Just be careful. I still had coffee. Now, they say caffeine is iffy, but do not drink anything hot. See, I don't. I put enough creamer in it on a daily basis that it's normally room temperature by the time I actually drink it anyway. So I still drank my coffee, I'm not even kidding, about 4 hours after the procedure, because I like my coffee. I can't live without my coffee. I got 2 kids. I mean, my hair's stressed out. So I need my coffee to survive. If they want me to survive the denture journey, I don't give up caffeine. I do have to say that I am a smoker. And people always ask me about questions about smoking. Now, see, with immediate denture, it covers the sockets. And when I smoked, I didn't puff anywhere you suck in your cheeks, you make the sucking motion. That is what causes a dry socket. All I did was a normal inhale, what was by my mouth, and then I let it out. Very slowly and precision. No sucking motion can be done at all. You can dislodge it, especially in the first week. Do not gamble that. Do not brush your gums until you start to see your skin heal over your socket. You will dislodge it. So you need to be very, very, very careful of that. So what I did was saltwater rinses were everything. You have to saltwater rinse. If you do have a loose-fitting denture, and the dentist doesn't want to do a soft reline, because most of them don't, but a couple do, especially when you get your first extraction done, which is pretty dangerous in my eyes, but you can put adhesive on your palate. Do not put it on the gum section, just the roof of the mouth part only. Hold it in there. That's what I did for the first month until my gums healed. My gums are very slow healers because my autoimmune disease and my immune system sucks. Like, let's be real, it sucks. So for everybody that does have an autoimmune out here, you got to understand that our healing process is going to be a little slower, especially if you're on meds, but if you have a weak immune system. It really depends on your immune system's fighting ability for this one. But make sure that your dentist gives you any antibiotics or pain meds prior to the procedure. Nobody wants to go to the pharmacy looking like a hot mess going over there. Nobody does. Especially if you're worried about blood, because you're trying to stop the blood, and the first day is iffy. You don't want to do that. So do not be afraid of what I like to call, well, the whole dental world calls, like monkey mouth, or like when your whole mouth. When I first got my dentures, you know how a monkey's mouth sticks out some? Well, that's what mine did. And my teeth were down lower. I hated them. Hated them. Do not freak out, please. Please don't freak out. Many people told me to calm down, because as the swelling goes down, everything goes up and everything gets fixed and the swelling does go down. Have I lost some of my lip? Yeah. But I lost some of my lip to begin with because my autoimmune disease, it's just dentures made it worse. So, but please be patient with yourself. Do not think in the future. Don't even try that. Take one day at a time is all you can do. Do not compare yourself to another person's journey. Just be prepared for your healing period. Like, I gotta say, the first week was rough, but really after that, I was pretty much good. I didn't have any extraction pain. I had none. So the only pain I had was taking my denture in and out. And that I just took Benzodent. You know, it's a thick paste, so it hangs on pretty well. And I put it on my gums itself, because that's what it tells you to do. So you put it on the gum part where the denture sits and stabs at it. You put it all through there. Wait about 4 to 5 minutes. Do not put it in right away, because you want the Benzodent to numb you. Once it's numb, you put it in, smooth sailing. Not a problem. Make sure you get a soft bristle toothbrush. People like to use the denture brushes. Some people, most people, I gotta say, use soft bristle brush. The denture one seems way too hard for me, and I fear of ruining my dentures, even though it's what they're made for, so I use my regular soft bristle brush. Get it anywhere. Just regular toothbrush, soft bristle brush. And people use toddler ones too. Try to start out with Polydents. You could do 3-minute because it's probably going to stay in your mouth. Let's be real, overnight, because if I'm telling you, if you take it out overnight, you might not get it back in. Really depends on the person and the swelling, but I wasn't going to risk that. And my dentist told me not to risk that because it might not come back in. So when you do take your denture in and out, if you can, I'm allergic to it, but if you can, take ibuprofen. About 45 minutes to a half an hour before. That'll help bring down some of the swelling so you can pull them out. So you're not in so much pain. And then when you put them back in, you're already taking ibuprofen, so just do your Benzonet and slowly put them back in. You do want to have different adhesives. Ask your denture for the trial size they have over there. It depends on your dentist and what they, offer. But pick up, what I did was I picked up the Poly Grip powder. That's what I used a lot in the beginning because my dentures fit really well. So it wasn't super loose until after a month, and then it was ridiculously loose. And now, without a soft reline, my whole denture can't even stay in there, it just falls right out. So I do try my permanent ones. In about a couple of months, I start fitting for them. Hopefully, if everything goes well. Still waiting on my insurance to approve my partial bottom. But honestly, I don't even know if I want to wear it because I am used to what it is now. But also make sure that, you have a good normal adhesive if you want to try that out. Do not try C-Bond yet, because that is like a cardboard cutout that goes over your denture and your gums. If you have a loose-fitting denture for the first month, my dentist and everywhere tells you do not put anything on your sockets until the skin has healed over your sockets. Because when they start to close, if you don't get all that out, you can break your blood clot if the skin's not over it. And then if your skin is over it and you still have that hole there but the skin's there, this adhesive could stay in there and it can cause infection. So that was the number one thing my doctor stressed to me. Do not do it until it's mainly closed up and, stick to just my palate. And, adjustment-wise, don't be afraid to get an adjustment. Especially up here, because mine literally sit here, go all the way down here, and they go through here. They're up into my area. All my areas. But if you do too much because your gums aren't used to it and you're in pain, I'm telling you right now, you're going to break the suction of your denture. So you need to please be careful. So many people stress that to me. And honestly, the only ones I've ever did was ones that are up here because when your gums shrink, it goes up. So you want to trim this down a little bit to where it's right underneath it. And right by my cheekbone, because my cheekbone's all over the place. This part was crashing right into it. That's the only adjustments I had. That was it. All the other pain, I sucked it up and waited a few days and it went away on its own. But make sure you're prepared for doing milkshakes and smoothies and get mashed potatoes. You can get meats if you're using your immediate dentures because when your sockets are free range, you need to be careful what you eat. But if you are getting immediate dentures, just remember the crock pot and slow cooker and all that makes everything super soft. So about your second week, you can definitely try it out because you still have to get used to the pain of the denture and you don't want to push hard because that'll make the pain worse. So go with eggs and mashed potatoes and you could do oatmeal. There's things like that. But definitely make sure you get the Fresh and Bright ADA approved denture toothpaste. Your soft bristle brush is necessary. Make sure you have paper towels because I swear stock went up since I got dentures because I use a lot of paper towels to dry off my dentures, to if I do my adhesive, to pull out the adhesive on certain spots if I can't get way back there. I use a lot of washcloths. Yeah, not kidding. And that's only half of them I have. I have a lot of washcloths. Nice cushion. I don't want to waste all that water. And I honestly am afraid it's still going to break. I'm slightly on the paranoid side. So I like to be really careful when it comes to that. Make sure that you do get Benzonet. Because no, I'm not sponsored, but it really does work. And I'd rather you not in pain and then regret wish you got it. You can also get, hold on, I'm going to show it to you. Clove oil. If you ever get pain, do not put it on your open sockets. Don't. But for future, it's also a natural antibiotic and, numbs really good. Do not put it on your sockets though. Don't do it. Wait until after a week or so. So definitely get the adhesive that you want to go for. Honestly, I tried Fix-It-Dent first. because that's normally the go-to that everybody keeps telling me to try first. And it was actually the last one I tried. Fix It Out was the last one. I tried Polygrip first, and it didn't work. But pick a powder, and then pick a paste. And when you are ready to use adhesive, you can try to see which one works for you. That's the main goal. But also, don't forget your denture box. And I do not have mine on with me, which we're going to go find it and going for a trip. You need a denture box to soak it in. People say you could just put it in a cup. Don't just put it in a cup. Because if the cup is glass, plastic, you drop them down. You have 2 dentures. It can break. I mean, just because you have water in there, don't mean anything's going to break. So, I'm going to put my light on and show you. My denture box. This is my denture box. It actually goes, we'll use that. This actually has grip things that clip to the side. Well, the back of it, if I can see. And it stays just like that. You can drain it naturally on its own. Goes in there, closes, do your thing. I did teal for scleroderma, but awareness. But you can get any one. I got mine off of Amazon. And, I mean, there's a ton of them everywhere. Walmart has them pretty cheap. You can go into Rite Aid. I think they're like $5 for the white ones. But it's your choice of what you want to do. But make sure you are prepared. Because if you don't want to go out, which you're not going to, your face is going to be swollen. And some people bruise. Do not be alarmed. Bruising is quite common. So, it will be okay. You will get through this. The first week is the hardest. But just remember, you will end up with a nice smile again. You will be able to chew food again. And I will be doing a food on how to eat with dentures. Because that's a little tricky sometimes, depending on the food you eat. Like, don't go eating a steak hardcore. But that will be the next video. If anybody has any other questions, you can feel free to go down into the comments. Don't forget to subscribe below, click on the bell, and hit all. And don't forget to like. Thank you. Have a great day, guys. God bless.